All right, welcome to another episode of Medicare Industry Insider. Today we're going to go into the ins and outs of home health care, whether it's worth it, what is covered, how much it costs, and overall what you should be aware of as an agent in the senior industry regarding this topic. There is a lot of controversy around home health care because it can sometimes underlie in different product lines. Maybe people have different funding set up to help cover that, but there is a lot of expenses that go into that a lot of people don't think about. And according to a 2018 AARP survey, 3 out of 4 Americans over the age of 50 hope to remain at home. So it's way easier to talk to clients about home health care opposed to like death or recovery here in a nursing home or anything like that, because people want to recover at home. So it's definitely a good option. It's something to take a look at, but we'll dive deep into the trenches of home health care as we get through this episode.
Absolutely. So let's talk a little bit about the service before we talk about the product, home health care, and what it is, why someone might need that. There's a couple of different reasons. There's also 2 different types of home health care that we're going to talk about. We're going to talk a little bit about recuperative care, like as an alternative to being in a skilled nursing facility. And then we can also talk a little bit about more that long-term custodial care, both of which can be covered by home health care under the right circumstances. But really, it's a lot of different services that are performed in your own home after an injury or illness, and it is typically less expensive. It's designed around that convenience of being in your own home, and it's supposed to be just as effective as the care that you would receive in a skilled nursing facility. So if you are in a position, or if you got clients in a position where they are making that decision between skilled nursing facility and care at home, sometimes the choice might get made for them if there's not a bed available at the skilled nursing facility. But by and large, we're looking at people who want that as an alternative. If they need mobility assistance, if you don't want to go to that assisted living, or you want to have a client that wants to live independent, if they've got those problems with those ADLs, those activities of daily living, motor skills, can't drive and they need transportation, if they're isolated and they need that caregiver as a companion as much as anything. There are a lot of things that might qualify someone as a good fit for home health care services. But of course, then we've got to get it covered.
Yes. So how does Medicare cover this? Well, it is interesting. So Part A and or Part B can cover these services if you are homebound, which can mean different various things, such as leaving your home, having a little bit of trouble. Maybe you use a cane, a wheelchair, a walker, crutches. It could be because of a special injury or illness that you're recovering from that you may just need home health care from. Basically, when leaving your home isn't recommended because of a condition can also qualify you, or normally unable to leave your home because of a major effort. So covering home health care can include wound care, patient caregiver education, intravenous therapy. So like if you were getting a IV drip or something, or maybe they have to do a drip for antibiotics at home, injections, monitoring serious illnesses can also be a home health care thing too. There are also things outside of your home that are considered home health care as well, if you want to go into that.
Sure, yeah. So it could even include things like physical therapy, occupational or speech language pathology services, even things like medical social services, or that part-time home health aid care, but only if you're also getting skilled nursing care at home or in a facility, or that physical therapy or speech and language pathology services. So walking, bathing, grooming, changing bed linens, feeding, still not going to do the grocery shopping for you under those circumstances. Medicare's coverage of home health care really mirrors its coverage of skilled nursing facility care, in the sense that you do have to qualify for it based on that injury or illness. And the biggest thing is that in addition to the same qualifications as skilled nursing, that you need to be homebound, you need to have that certification from the physician or provider that you need this care and have a plan of care. The biggest thing is it has to be intermittent for Medicare to pay for home health care. If you require care every day, Medicare says you should be in a skilled nursing facility. you shouldn't be getting that care at all.
So I think that goes into what Medicare doesn't cover. And I think you started on that, but 24-hour daycare at your home does not get covered. I think that's what a lot of people's misconception is like, oh, I'll be at home and like someone will just like sit over there and live with me and like take care of me. No, this person is coming to check on you at whatever intermittent times that doctor has recommended. So it could be every other day, it could be every third day. So essentially you're still taking care of yourself, which means a lot of the time the family members are having to come and check on them and things like that. So it does not cover that 24-hour care. It does not include meal delivery. It does not include custodial things like bathing, dressing, using the bathroom. You mentioned before that it's only covered if you currently are getting part-time intermittent home care and are also qualifying for the home health care. So like it's very niche. Most of the time it is not covered, and that is something that the family has to set up for them. Which is very expensive also. And then homemaker services like shopping, cleaning. I think the cleaning one is one of the big ones, is like you, even doing laundry, like the little things that you do day to day are usually not covered by home health care. That is called home health aid usually, or that is a family member, or that's a cleaning service that you're paying for. So that is not covered currently.
And I think one of the big misconceptions though is that that homebound requirement means you can never leave the home or you're not capable of leaving the home. It doesn't necessarily mean that. It just means that it is massively inconvenient or unsafe for you to leave home. It doesn't mean you can't leave your home or aren't allowed to, are at the risk of coverage. You could still leave your home for certain non-medical reasons, for example, attending religious services. And then even if you're receiving something like adult daycare services, you can still get home health care under the right circumstances. Like most things in our industry, it's all about having the right billing codes, having that right of care, the right signatures from the right doctors. Unfortunately, this is one of those areas that's maybe more difficult to navigate than a lot of others because of all the complexities of frequency of care, place of care, type of care, and when it is and is not covered.
And I'll share a quick story too. I was just thinking through people I knew, which my grandpa was in a situation where he had cancer, stage 4, needed to be taken care of a lot, but he was wanting to recover at home because of where he lived and because of there wasn't any home health care facilities, anything that was approved by Medicare in his area. That wasn't an option. So you mentioned earlier that sometimes the decision is made for you because there's no beds on the skilled nursing. Sometimes it's made the opposite way for you too. Like there's just no home
No one really
health care facilities approved by Medicare near you. So as an agent, double checking that and making sure you know what is available to help your clients is going to be incredibly helpful. But the other thing is home health care aid services. You talked about all the extra things. The home health care aid is different than home health care, and that's not necessarily always covered. But there's a ton of different home health aid things to think about. And there are a lot of the home health care plans will include some sort of like extra benefit for the home health care aid. Yeah. But things like companionship, transportation, meal preparation, medication management, and reminders. A lot of these times, these people are sitting at home by themselves for maybe a day or two, and they have to manage their own medications and when they should be taking them. There's also housekeeping, which includes cleaning, dishwashing, laundry, transportation and other forms of mobility assistance. So if this person needs to go to the hospital, for example, that is not covered. So they've either got to figure out a taxi or Uber or Lyft or something, or a family member to take them to the hospital. Cognitive stimulation like conversations, reading out loud, and of course respite for caregivers is not included as part of or I guess that is included as part of a home health care aid. You would health aid, yeah. And actually, I think we talked about respite before. Is like if you are a caregiver, that is an option to have respite care.
Yep. Well, and I think the biggest thing about all of this that these can be such valuable services for folks that either want to avoid the facility-based setting or can't get access to a facility-based setting. And we know that there are better outcomes oftentimes for people who can recover at home if they get the proper care.
Yeah.
But that access to care comes at a price. And right now in 2024, it's a little over $5,000 a month. That's the average cost for in-home care in the U.S. based on a Genworth financial cost of care survey. And for home health care, the cost is higher at around $5,600 a month as opposed to some of those home health aides. But when you look at things like skilled nursing services, it's still more economical than being in a facility where that average is closer to $8,000 or $9,000, almost $10,000 in some cases. So there's still a lot of benefit to home health care, not just those improved outcomes, that ability to stay age in place, but also just from a cost standpoint, it's more affordable. And if the service is more affordable, it's also more affordable to insure against that cost.
Mm-hmm. And I was going to say, I'm curious. We didn't look into the trenches of that Genworth survey, but I'd be curious to see if they included a lot of the home health aid type things in that cost, because just home modification, someone taking off work, cleaning services, lawn care, like all the extra stuff that maybe isn't included. Maybe it was just looking at the home health care cost. So that'd be interesting to kind of take a look at that.
Absolutely.
In addition to that, we even looked at hourly services by state. If you're going to get a home health care person to come to your house, the average across the nation is $30 per hour. When I was looking, some states were even closer to like $50 an hour. So it can be very expensive to have someone come and do the simple home health services.
Precisely. And unfortunately, that's one of those things where, we're used to looking at, say, maybe a major metro area, high population area. We see general wage inflation, so we anticipate that things will cost more. But unfortunately, with a lot of healthcare services especially, they can even be more expensive in rural areas because of the lack of access to providers. So that $30 average could easily be $40 or $50 in a rural area, not just in a major.
Oh, for sure. So alternatives to home health care, there are options for people to try and get home health care in a hybrid way. So long-term care insurance can sometimes help with that if you can cash it out. Maybe you have an annuity with life income streams. Maybe there's a cash-in life insurance plan that person has had. If you are a veteran, taking a look at assistance with that as well. There is a lot of extra assistance for veterans, but little things like that, you can kind of piecemeal some sort of home health care funding if you needed to with different various things. Again, this is not a specific product for home health care, so you need to look at that also.
Absolutely. Well, and then there's also things like Medicaid. Many state Medicaid agencies will help pay for home health as an alternative to nursing facility care. But of course, that requires qualifying for Medicaid, at which point having your own home may not be entirely practical, unfortunately. So there's a lot of complexity to making sure someone has access to the care that they want when they want it. And because of that, it can oftentimes make sense to get those home health care services covered by a standalone home health care plan, or even a short-term care plan that offers facility or home-based coverage. So there's a lot of benefits to that type. If you can't get those home health care services, or your home is not equipped, you need modifications. You may not need a home health care aid. You may need actual medical health care services. But a lot of those plans offer riders or offer the availability of things to help pay for some of those modifications, to help pay for whatever type of care you need. So home health care can really be a value add, not just to your clients, but to your bottom line as an agent as well. So these are products that are sought after. That are much easier to qualify for than, say, a traditional long-term care.
Oh, very, very easy.
Much more accessible, premium-wise as well. Really common to see short-term care, home health care premiums under $150 on.
I would say that.
Drastically less expensive than a long-term care type policy, and many of them cover that beneficiary for up to 1 year, 365 days. So these products meet a pretty niche need where folks, instead of trying to navigate the complexities of how to get Medicare to pay for extremely limited care, instead of trying to navigate making sure all of the doctors sign the right paperwork and turn in the right claims, and dealing with, trying to find an approved agency, a home health care plan can simplify this process. And at the point in time where the mental cost of dealing with your insurance becomes more difficult than the coverage is providing, or when you no longer qualify for that covered care under Medicare, a home health care plan can easily step in and provide you access to whatever care best meets your needs.
I 100% agree with that. I think it's one of those things as an agent, being aware of your local area, what is available. Is it skilled nursing facilities? Is it home health care? Is it home health aides? Looking around to see and make sure that your clients are covered and know what risks they potentially have. And then, like Chalon said, if you can find something that is affordable, like a home health care plan, add some extra riders in there that maybe do cover the home health care aid or extra Part D benefits. Sometimes that Part D benefit, honestly, can make
A lot of the cost, yeah.
make it totally worth it. There are plans that will help cover that Part D, where it's just like you submit the claim and then you get a check in the mail. So it's very easy to get that back. So taking a look at what is available, take a look at your state to see if there even is home health care plans available as well. But in terms of just being a knowledgeable agent in your community, knowing what's available, talking through risk, that's what helps add value to yourself as a resource. And I think it is important to also be reminded that 3 out of 4 Americans do want to recover and do want to remain at home as long as possible. That was from an AARP survey, age 50 and over. So I think it is important to just take a look at that. But overall, I think just knowing about that there is a product available, that there is some risk associated with it, and that there is some access to care issues as well. And with that, we'll wrap up this particular episode. We hope you enjoyed, and we'll catch you later.